Hello everyone. I suppose that at this time you have finished learning already about how leadership and management functions are performed in the hospital setting. Now, at this point, it's time to take a look at how the leadership and management is applied in the public health system or in the community setting. For many reasons, management in public health is quite different from that of the management in the hospital setting. The generic management functions are the same, but the way these are done differ from one setting to another. Management in public health, particularly in the Philippine setting, is a unique undertaking given the different macro and micro contexts of the local public health organization, which usually are influenced by the government policies, the programs of the national government, the national and local health budgets, the geographical location, the political dynamics within that area, that influence the decisions of the population and its leaders, and of course the local culture. All of these affects how the management and leadership principles are applied in the community setting or in the public health setting. Now, how does the local public health organization operates? The health department or the health office is one of the departments and offices in the local government unit, which serves as the governing agency of the local public health organization. Now, the size of the department depends on a number of factors such as population size, financial capability of the LGU, and the local leaders' commitment to public health. So cities, particularly first-class cities like Manila, have more health personnel and more health centers. There are, however, poor municipalities without doctors, no? Because they are very poor. They cannot afford to to hire a doctor. So these doctorless municipalities is headed by a nurse who is usually a resident in that area. Now, big cities, demographically and financially speaking, have bigger health departments. So there are a number of divisions, one of which is a nursing service, like in the case of Manila. No? In Manila Health Department, we have the nursing service. And a nursing service has a chief nurse, an assistant chief nurse, a number of supervisors who are assigned to different programs, like for example, maternal and child health. And also, public health nurses and midwives are assigned to the different health centers. And usually these health centers in big cities, as well as the municipalities are headed by physicians. So it's usually the doctor who is the local health officer. Now, the in the pre-devolution setup, meaning before the rural health units were delegated to the LGUs, because rural health units exist in every municipality to improve access to health care. Before the devolution, these rural health units are directly linked to the DOH or to the Department of Health Central Office. However, the organizational connection was severed after health centers were devolved to the LGUs in the early 1990s. Okay? So, yun. So, the RHU or the Rural Health Unit now is under the local government unit. And its budget is coming from the the local government unit. Well, aside from those services and programs of public health units, no, that is funded by the national uh, government. The capability of the local public health system is influenced by decisions made by the local chief executive and council, especially those on budgetary allocation. How the budget is determined and the degree of participation of the health center staff in the preparation of the health budget varies from one LGU to another. Some health centers are consulted, no, with regards to the budget, while other health centers are not. And for those who are not consulted, they are just given their supplies. And many of the health center managers do not actually know their actual budget. It is therefore not uncommon for supplies to be depleted before the next delivery of supplies because of lack of coordination or the lack of participation of the health center staff to budget allocations, to budget planning. Purchases of medical supplies and medicines are done by another office. Although this is a standard practice, what is unfortunate is that the end users are sometimes not consulted about the specifications of the goods to be purchased. Some of the contentious issues in a number of health centers is the appointment, promotion, and movement of health personnel. There are many cases where qualification standards and established procedures are not followed. There are cases where a nurse or a midwife is reporting for work with his or her signed appointment papers without having undergone adequate screening procedures. There are other factors that affect the delivery of health services and implementation of public health programs. Since health centers are usually located in the town proper, the residents of far-flung barangays find it difficult to go to town for consultation. Travel time is long and transportation cost is high. Although there are barangay health centers, the needed medicines and supplies are not always available. To make things worse, there is no efficient communication system that link the health centers to the barangay health stations, as well as those far-flung catchment areas, no, or coverage areas. Now, these factors, in addition to client-related factors, pose as threats or as challenges to the public health system. And a nurse, no, who is working or who is about to be a nurse manager in the local public health organization must be aware, no, of all these challenges and hopefully be able to come up with solutions, no, to at least um, yeah, lessen the burden on the populace. Well, we hope you do have the power or you do have the influence. So one basic reality in the local public health organization is that most local government units do not have adequate resources for health. However, on a positive note, there are local government units with outstanding performance despite their meager or limited resources. And to achieve this, nursing, no, has a unique contribution. And we as community health nurses who will focus on public health nursing must remember that even though there will be times that we will be given non-nursing assignments, our primary responsibility should still be nursing care, or rendering nursing services to our clients. And again, these are the individuals, the families, the population groups, and communities. Okay? Now, the rural health unit or the health centers um, and its services and programs address the major health concerns, that usually are reflected in the leading causes of mortality and morbidity. So the major programs are maternal and child health, communicable disease prevention and control, non-communicable disease prevention and control, including the lifestyle diseases, nutrition, and environmental sanitation. Now, some health centers have other programs, such as those for specific population groups, like the older people or the senior citizens. Some of the health services provided are immunization, prenatal, natal and postnatal care, consultations, laboratory and diagnostic examinations, emergency medical care, treatment of common illnesses, and referral to hospitals. Now, the extent of services is primarily determined by the availability of financial resources in that particular rural health unit. So, the financial capability of the local government unit is very important in the provision of these services. We have mentioned a while ago that management in the community setting is quite different, from that of the hospital setting for many reasons. Um, the generic management functions of planning, organizing, staffing, directing, and controlling are the same, but the way these are done are different from one setting to another. Now let's take a look at how the management process or how the steps of management is applied in the community setting or in the public health setting. Now, as a manager and supervisor, the public health nurse or the community health nurse participate in planning for the whole local health organization. A component of the organization's plan is a nursing unit plan. And there are different types of plans that a nurse is exposed to in a public health system. And these are the strategic plan, the operational plan, the program plan, and the nursing care plan. All right? A strategic plan is a long-range plan which extends from 3 to 5 years. In strategic planning, managers review the organization's strengths, weaknesses, opportunities, and threats, or what we call the SWOT analysis. And also, the nurse reviews the organization's beliefs, mission, vision, and goal. Although strategic planning is a function and responsibility of all managers in the organization, the initiative usually comes from the top management. Um, in a public health organization, the chief nurse or equivalent position should participate in strategic planning so that the aspiration of nurses and their unique contribution could be adequately articulated. Okay? An operational plan, on the other hand, is a short-range plan that generally deals with the routine activities of the organization. In a health center, for example, an operational plan addresses the requirements for delivering health services. It may include the training of health center staff, purchasing of instruments and equipment, introduction of a new system in queuing of clients, and a new system of recording, among others. These are all gathered in a manual of policies, standards, and procedures, which are very important for health personnel. These serve as a guide for the actions and decisions. All pertinent policies shall emanate from national agencies such as the Civil Service Commission and those that is coming from the local government unit. It should also contain professional standards prepared by the Department of Health, by the Professional Regulations Commission, and the Philippine Nurses Association. A nurse manager should ensure that all important documents are available to the Rural Health Unit nurses so that they are informed of their rights and responsibilities as health workers and duties as government employees. The nursing service should have a plan that addresses the specific needs and concerns of nurses. While the general, for the whole health department, operational services plan is primarily for healthcare delivery, the nursing service plan focuses on those that impact on how nurses perform their job. It may include objectives related to staff development, performance evaluation, review of job description and performance standards, reward systems, and others. These plans should be realistic and should be acceptable to the decision makers, who are the local council and the mayor. Any plan or program, particularly if it would require a significant amount of financial resources, should have the support of the local council and the mayor. The local health board may also be able to help in advocating for the nursing service plan. Now, in preparing the budget, now we have mentioned a while ago, that sometimes the health center's staff are consulted while some health center staff are not. And also there are health center staff who do not know their budget. And in a number of these LGUs, it was reported that there were no budget proposals that were submitted by the health unit. So, knowing how decisions are made at the local level, the health center staff should be able to make a good presentation of their budget proposal. Public health nurses play an important role in preparing a budget for the health department or the health center. They know how the health center operates and the demands for the health center services. In preparing a budget, public health nurses should consider the cost effectiveness of their intervention or activities. All year round, they should assess the cost effectiveness of their activities or practices in the health center and constantly explore on ways to improve their efficiency. Now, a sound budget is based on carefully identified requirements. And these are, number one, drugs and medical supplies, instruments and equipment based on the number of clients or procedures done, or medicines dispensed, etc. on the previous years, the adjustment due to projected population increase and additional health programs. Okay. Well, aside from the instruments and equipment, the necessary financial support for personnel like the salaries, GSIS, PhilHealth contributions, retirement benefits, travel allowance, Magna Carta benefits, and staff development plans. Okay, so aside from those necessary financial support for personnel, a sound budget also includes repairs and maintenance of the health centers. including the ambulance and other related expenses. All right? You have learned that the organizing function of management entails setting up of an organizational structure, staffing, and the development of job description. Now, prior to the Republic Act 7160, um, or the Local Government Code, where the healthcare services are devolved, no, to the LGUs, the organizational structure of health departments or units was standard, which means there was a nursing service in big health departments who was headed by a chief nurse who usually has a salary grade of for nurse 7, no, or nurse 6. Understandably, there had been and there will be structural changes in health departments and health centers because of changes in how decision makers view healthcare delivery. There is, of course, no one best way in structuring a public health organization. Most, if not all, public health organizations already have an existing organizational structure. The question, however, is whether the current structure is the best way by which the goals of the organization could be met. No, could be met in assessing an existing organizational structure. We may want to review some of the principles of organization. One principle of organization that can help us assess an existing organizational structure if it is meeting the goals, no, or if it is the best way, no, or the best structure by which the goals of the organization could be met, is the principle of the division of work. This is also called specialization or departmentation. How will the work health services be divided? Is the division of work according to client groups? Say, for example, children, women, elderly? Or is the division of work according to the two programs? Say, for example, maternal and child health, communicable diseases, non-communicable diseases. Now, in big organizations, services can be organized into clusters or teams. This means that a group or team of service providers that includes a physician, a nurse, a midwife, and others are assigned to a specific program or service. However, in small health centers, probably the only division of work that could be done is the one based on position or profession. So, what are the duties and responsibilities of the physician, nurse, and midwife? Sometimes the distinction of these professional responsibilities is not clear because if there are no doctors, nurses and midwives perform what are strictly legally considered as medical functions. Okay? Then next is coordination. Coordination is what you have learned, no, in the leadership and management uh, principles, is that it is the conscious activity of assembling and synchronizing differentiated work efforts so that they function harmoniously in the attainment of organization objectives. Proper coordination results in harmonious relationship among the different groups within the organization. There are functions common to all programs or services that these should be well coordinated, among which are training and information, education and communication, or training and IEC. There should be an established mechanism to coordinate efforts in these areas Usually, there are people assigned as coordinators for special concerns. This assignment is in addition to the person's regular function. The next principle is the unity of command. This principle means that an employee should be responsible to and receive orders from only one superior. In some health organizations, this may not be possible. For example, public health nurses who are assigned to health centers may be responsible to and receive orders from two people: the chief nurse, who is usually based at the health department office, and the head of the health center, who is usually the doctor, no, the local municipal health officer. To prevent confusion, no, and ill feelings among the staff, the areas of concern and responsibilities of the two heads should be adequately delineated. All right? On authority and responsibility, authority means a superior's right to command and exact obedience from his or her subordinates. If a person is given responsibility in the organization, he or she should also be granted corresponding authority. No? So, if a public health nurse is given a responsibility as an EPI coordinator or the expanded program on immunization coordinator, she should also be granted corresponding authority to coordinate. Span of control is another principle of organization that can help us assess, no, if the current structure is the best way by which the goals of the organization could be met. So, span of control means the number of subordinates reporting directly to a superior. Now, in the public health setting, the span of control for a public health nurse who is supposed to supervise midwives is determined by a number of factors, some of which are level of training of the subordinates, degree of dispersion or how far the subordinates are from each other and from the superior, and the level of difficulty of their work. There are, however, no fixed rules in determining the subordinate superior ratio. If nurse supervisors are adequately recording their supervisory activities, it may be easier, no, to establish span of control in their respective areas. Now, where is the nurse in the organizational structure again? Given the changing landscape of the healthcare delivery, we have to confront these questions. How should nursing or nurses be reflected in the overall organizational structure? Should there be a separate nursing service or unit in the local health department? What roles and functions should be assigned to public health nurses? Of course, there is no single answer to each of these questions. That's why nurses should actively participate, no, in configuring the organization. Where do you think you should be placed in the organizational structure so that you can best meet the organizational goals? Okay? Staffing means determining the number of personnel that an organization needs to meet its objectives and demands of its clients, and of course assigning the right, no, or the qualified people to the different positions, guided by their job descriptions. Now, one of the problems of the local government units is the inadequacy of health personnel, which is mostly due to inadequate health budget. So, the concern in staffing is to have an adequate number of nurses, midwives, and barangay health workers for the total population. There should also be a contingency plan in times of greater need, such as disasters, epidemics, or like what we have now, the COVID-19 pandemic. And yun nga, but because the major problem of the LGU is its inadequate health budget, which also results to inadequate health personnel. So nurses should properly and adequately document their activities so that their proposal for increased staffing will be considered seriously, no, by those uh, people who are working on the health budget of the local government unit. Okay? To lead means to show, mark the way, guide the course. It is analogous to coaching. So leading, therefore, is the process of ensuring that personnel do what they are supposed to do in order to accomplish the goals of the organization. It involves processes such as leadership, motivation, and communication. Now, when it comes to leadership, the essence of leadership is influencing others. In an organizational context, it is making people want to do something. According to Frunzi and Savini, leadership is characterized by five key behavioral functions: coaching, counseling, evaluating, delegating, and rewarding. So leadership, therefore, is an important component of good management. The challenge for nurse managers and supervisors, no, is how to influence their subordinates to pursue the goals of the organization. Specifically, in public health, leadership is influencing the staff to, number one, behave respectfully towards their clients; number two, provide quality service; number three, meet program and or service targets; number four, observe cost containment measures. No? So, kailangan magtipid and observe organizational values such as honesty, cooperation, and punctuality. Now, what is the best style of leadership in a public health setting? Leadership or literature discusses the different theories of leadership: great man theory, charismatic theory, trait theory, situational theory, contingency theory, path goal theory, situational leadership theory, and transformational leadership theory. Later on, yeah, we have the servant leadership, etc. And also their strengths and weaknesses. You have learned that, no, in the previous discussions. Now, with their different emphasis, there is a need for an integrative leadership model, according to Mariner Tomei. There seems to be a consensus that there is no such thing as best style that everybody should adopt. An effective style is one that considers and maintains an appropriate balance among different considerations: organizational goals and culture, personal values, and the situation itself, no, the circumstances where the health personnel are in. It is dynamic, no, and not static. So that the leadership style should be dynamic and not static. Therefore, the nurse manager should always be searching for a leadership style that works. All right? Communication is one important component of leading or directing. In fact, communication is the most pervasive activity within an organization. While working or while they are not doing anything, people communicate something. However, the communication that is of great interest to nurse managers is one that moves people to action. By the way, communication, no, the flow of communication, usually with the nurse managers, is vertical, upward and downward, and horizontal. Nurse managers communicate to their subordinates about a number of things. policies, standards, procedures, and the work that needs to be done. Pertinent discussions and decisions made by the local chief executive and the local council, and also feedback on important personal issues and concerns. In addition, they convey their concern for their subordinates, including the families, no? The families of their subordinates, particularly their well-being. So this is how managers communicate to their subordinates. They also communicate upwards to the head of the health department or health unit and to the local officials. So to the head, who is usually the doctor, and to the local councils and the local executive officer, who is the mayor, no, or it could be, yeah, the governor. They communicate to inform, give feedback, and to influence, no, to influence, particularly in the health budget allocation. Their communication to the LGU's decision makers should be properly planned, no, particularly the content and the medium. Now, if the purpose is to influence, then nurse managers now should have a very good presentation, whether it is written or oral. In addition to these formal approaches, nurse managers should also be able to communicate in a style that is culturally appropriate. Meanwhile, nurse managers also communicate with their peers from other offices, um, like the personnel department, purchasing, supplies, accounting, etc. The managers communicate with their peers to enlist their support or assistance. So maintaining an open communication line with the heads of other offices or units can facilitate the flow of papers and goods for the health department, no, or the health office or the health center. In small organizations, communication with peers is more informal. In the Philippines, our interactions within the organization, particularly among peers, is very personal. And the manager must be able to, yeah, to adapt, no, and to be flexible, no, in her communication skills. Okay. We have mentioned a while ago that delegation is one key behavioral function in leading. No? So public health nurses should delegate, not to save time, and also to develop others for their future roles and responsibilities. If a midwife can do a task very well, then the nurse, no, should delegate some task to her that of course are doable, no, and according to the expertise of the midwife. Controlling is another step in the management process and one important function of a manager. Controlling was defined by Fayol as verifying whether everything occurs in conformity with the plan adopted, the instructions issued, and the principles established. It has for its object to point out weaknesses and error in order to rectify them and prevent recurrence. This definition, together with many others, have four major components. Number one, the plan, instructions, principles, and standards. Number two, the observation, measurement, and comparing what is with what should be. Number three, identification of weaknesses, problems, or errors. And number four, correcting, rectifying, or doing something about these errors or problems. It is the nurse manager who introduce controls within the organization. Controls are important in improving service delivery because they serve as reminders if there are deviations from targets and standards. There are a number of controls that could be introduced into the public health unit, some of which are statistical reports, records, no, records on medicines, family planning supplies. Also, another is audit, Gantt chart or schedule of activities, client feedback, and incident reports. An analysis of these, together with personal observations, give the nurse manager an idea of how things are going in the healthcare unit. Okay? Evaluation of personnel uh, is also another important function, no, of the nurse manager. And there are many reasons why nurse managers should evaluate their staff. Mariner Tomei actually identified 10 purposes of performance evaluation. And number one is to determine job competence. Number two, to enhance staff development and motivate personnel toward higher achievement. Number three, to discover the employee's aspirations and to recognize accomplishments. Number four, to improve communications between managers and staff associates and to reach an understanding about the objectives of the job and agency. Number five, to improve performance by examining and encouraging better relationships among nurses. Number six, to aid the managers' coaching and counseling. Number seven, to determine training and developmental needs of nurses. Number eight, to make inventories of talent within the organization and reassess assignments. Number nine, to select qualified nurses for advancement and salary increases. And number 10 is to identify unsatisfactory employees. Now, in the Philippines, the evaluation of the performance of government employees is mandated by the Civil Service Commission. Although there are many possible uses of performance evaluation, the most prominent are termination of non-performing assets and promotion of competent and model employees. From time to time, there are opportunities for step increases in salaries. Because the available amount is limited, only the good performers are given, no, or should be given. It is therefore incumbent upon the supervisor to evaluate the performance of his or her supervisees, no, or subordinates properly. The performance appraisal of a public health nurse should focus on his or her duties and responsibilities, including additional assignments given to them. The rating given to public health nurses should be based on the extent to which they meet performance standards. It is the responsibility of the nurse manager to define the standards of performance for the different nursing personnel, and this should be done in consultation with those who are concerned. Regular evaluation is done to ensure quality, and quality assurance is an important management activity to honor the health facility's commitment to provide quality care to its clients. It basically defines, the structure standards, the process standards, and the outcome standards. Um, and so with these or anchored on these structure, process, and outcome standards are the outcome evaluation, which can be in the form of summative and formative. We also have process evaluation that assesses or evaluates every step of the process, its effectiveness, efficiency, and also the structural standards, or the structural evaluation also are done anchored on the structural standards for quality assurance. Again, in summary, management in public health, or in the community setting, particularly in the Philippines, is quite unique. It is a unique undertaking, given the the different macro and micro contexts of the local public health organization. So even though the management functions are the same for the hospital setting and the community setting, the way these management functions are done, these functions of planning, organizing, staffing, directing, and controlling, the way they are done in the community setting is quite different, as we have discussed. A little different from the hospital setting, although the principles are the same. And please remember, that aside from the uniqueness, of the local public health organization, the context also differs from one local government unit to another. So all the more that the nurse manager must be aware and must be very conscious of how he or she is dealing, with uh, with the people, within these different contexts in the local government units. Okay, thank you everyone for listening. I hope that you have learned how it is to practice leadership and management in the community setting.